as far as performance go, and that's where the physicians are using the most compared to the non-promotional pharma channels, and then of course the promotional pharma channels down the bottom there. So this is a really nice gauge to show to management, hey, we need to be in the social media space, and here's why. And there's much more deep data on this. I'm kind of giving you, a little overview here, but we dig down pretty deep on this, these different tactics and the way they influence physician groups. And this is one example, actually. How are you performing in each channel against the competition? So we have A, B, C, D, E. Those are there's 5 different brands in the marketplace. And we know how, if for each one of those brands, what channels are performing the best. And this is just an example of a key page from the report that we use. And it gets into a lot more detail than this. This is a little bit blinded because I couldn't give you all the customer information. But certainly it's something, a part of the report that you would get if you use this marketing mix. And this is another slide as well. It really points out, see on the top there, it says company-sponsored medical education, rated #1. So I think, if you really look at the results from the marketing mix assessment, if you're going to use it in your company, it gives you, I think, a unique insight into the marketing channels that you're using today and how you might want to go to market differently in the future. We saw cost savings of 10 to 30% have been documented, refocusing to different channels. So, it's funny, a few years back, I was working at a big agency in New York, and we had 60+ print tactics that we threw out to the customer. We had no idea what we were getting for that, and at the spend. If they had a marketing mix assessment at that time, they would have probably refocused a lot of those 60+ marketing mix tactics on print to a lot of online. And that's I think, in the new age with the brand managers and actually in upper management as well, if you can get that kind of message to them, you're going to be able to sell in programs that have high impact with your customers. And I think kind of in the conclusion here, the marketing mix assessment in the long run, I think it's very unique in the industry. Like I said, I've been around pharma 23 years. I've never used a tool like this before I came to Cross Health, and I think it's helping our client base make decisions on what they need to go forward with in the marketplace. And that's it. Any questions? Yep.
Can we get you, Mike?
How do you work out the volume that is actually attributed to each of the marketing mix?
Repeat your question?
Sorry.
Here's a mic now.
How do you work out the volume that is attributed to each of the marketing mix areas? How do you know that the volume has been driven by the web or by the e-detail or by the sales rep?
How do we know how each tactic, the amount the physician uses it?
Yeah.
Well, we asked that in the contact. We asked them, have you ever seen this communication, and have you used it, and does it help increase your awareness of the brand? There's a number of questions we ask, and so that's how we do it. Okay. Any other questions? Yes? Over here? Yep.
I just had a question about the metrics that are used. Is it all self-reported data by the physician, or are you also using prescription metrics?
We do both, actually. It's self-reported data, and we back it up with other metrics. So it's, and it depends on what market, and we do work all around the world. So there will be different metrics. So you're saying, is it backed up by IMS data and things like that?
Right. So,
Yep.
so if somebody says, I was influenced by the email or the e-detail, and then you know that that particular physician increased their prescriptions a certain amount?
Right, yeah. And also I think that we go back and look at the, after the marketing mix is done, we see if indeed, the certain channels like the measurement of sites. We know a physician, if we had 60% of our physicians do a knee detail, we know that they've told us that and they're doing it. So we do that as well. So we'll match that up with all the tactics as well. So that really is, I think, a helpful thing to do. So. All right. Oh.
You were comparing your client brand against the other brands in the marketplace. How are you getting the information on the other brands in the marketplace?
We use it, well, two ways. We have market research. We work with all the marketing research groups. So when we do the marketing mix approach, we work directly with the marketing research groups. So I mean, actually, I think it's a good approach here when you're if you want to do this marketing mix, to have your marketing research folks involved, because they really help with that.